Hi, thank you so much for joining our panel on health policy today at the AUA annual meeting in 2021. I'd like to welcome our panelists today. We have three incredible panelists. We have Dr. Spitz, who is currently a urologist at Orange County Urology Associates. He's formerly the representative to the AMA House of Delegates, for which he held that position for over 10 years. And he currently serves as chair of the AUA Urology Telehealth Task Force. We have Dr. Rhee, who is the national chair of Kaiser Permanente. He's the chair of the AUA Public Policy Council. And lastly, we have Kathy Shanley, who is the executive vice president for public policy and advocacy of the AUA. Thanks so much for joining us today.
Thank you.
So I have a list of questions, and I'm hoping that the panelists are able to answer these questions in no particular order, but to questions that they feel is relevant to them. So the first question I have for the group is, why should trainees care about health policy?
I'll take that on as far as that first question is concerned. I think it's a good starting point to understand those who are actually listening really already have an inherent desire to see where they can make a difference as far as that's concerned in regards to their careers. I've always I think people, when they start their practice and their careers, they think about making a difference for sure beyond the clinical realm. My advice has always been to be, as when you're starting out as a young urologist, is to be as good a clinician as you can, and the rest sort of follow. Leaders, we're all leaders in our own right as we practice. If you think about it, practice urology, and I think that the idea of public policy and getting involved, and why should trainees be involved, is really a question that is a personal question, and that it's the why, if you will. Simon Sinek is a corporate strategist. He's famous in regards to a principle called the golden circle, and the golden circle is really, everybody knows what they do. Every organization on this planet knows what they do, whether it's the products they sell or the services you offer, and in this case, urologic care. How you do it, right? These are things that make you special or set you apart from others. You may be a fellowship trained infertility specialist, and you know how to do those things, and that's your objective. But really, people go to that inner circle. The most important circle is why. And very few organizations and individuals know why they do what they do. So it's not about it's really about a purpose, cause, or a belief. It's the very reason that you actually, you wake up in the day and get going. And really the why is really important in public policy work, because public policy, as far as mission statement is concerned, if you look at the AUA, right, research, education, clinical practice, but it is included in the mission statement as public policy, and that's really about advocating for our patients in our practice. And things have now popped up that have been really existential, right? The last 19 months, as an example, and we can talk about that more in this, in our discussion. But trainees should care about it, because this is really where we have the attention of the world. Our patients are fascinated, really, and curious about how we deliver care through these uncertain times. So it's an opportunity for us.
And Dr. Rhee, I would love to add in, as the staff liaison that's heading over to an agency or to the Hill, we actually love taking your stories with us, because we can talk the technical details, but really attaching meaning to what we mean when we say this is not a good time to make a change. Our physicians are overburdened. Hospitals are suffering from a drain of resources and finances. And you as trainees can bring those stories to us so that we can share them, and really just put the exclamation point on the back end there.
Yeah, I'd like to add that whether we like it or not, there are other individuals with less information than us, without the day-to-day hands-on experience and patient responsibilities that we have, that make decisions that affect how we're able to provide care to our patients, as well as even how we're able to receive our training. And only when we get involved and provide education and feedback and even become allied with these individuals that determine our fate, can we start to help determine our own fate. And only through becoming involved in public policy are we able to stop just being swept with the tides and start directing the currents that are going to affect our training, our career, and the health and well-being of this nation.
Right. I think in advocacy work, there's an expression: people don't buy what you do, they buy why you do it. And I think, you know, we're the thought leaders, if you will, as physicians, and public policy really, you know, follows sort of Aristotle's philosophy of ethos, pathos, logos. Ethos is really, are you the appropriate person? Pathos is the passion. Do you have the passion, a balance, right? Not as in terms of expressing yourself. And logos is the logic behind the advocacy that you present. And I think those three elements really help you not only professionally, but personally, as a physician and as a human being. And I think public policy is just a really great forum to practice those three elements of Aristotle's philosophy.
Yeah, I was just going to add on a personal level. I had the opportunity to do one of these advocacy days, and it's going off with a lot what you guys have said. It's amazing how little many of the lobbyists and the staffers know about urology and what they know about medicine. And I think if you're not there and you're not advocating, someone else is there and they're advocating. So I completely agree with you. Now is the time for residents and fellows to get involved, which leads me into my next question, which is, if you had to pick one opportunity for a resident or fellow to get involved with at this point in their career, what do you think it would be?
I'll take that on. I think I recommend that the opportunity exists to directly interact with your state, local, national legislative representatives. I think these legislators are key to introducing or supporting legislation that changes healthcare policy for the better. And I think that that's really an important aspect that you can do right now. That's something I'd like to add.
Now I think there's the Gallagher. Oh, sorry.
What I would like to recommend is showing up to opportunities. It may be as simple as your very local urological association at the county level. It could be state meetings through the state networks. It could even be as simple as showing up at grand rounds once you're out in practice, if you're not still in an academic environment. But showing up to the meetings at whatever level they exist, and it can even be at the state medical or county medical society. It doesn't have to be a urological association. Gives you the opportunity to meet other physicians who are engaged in advocacy and are looking for help, are looking for people who have interest and capability. And there's a high likelihood that you will find an opportunity through that kind of networking that puts you face to face with a legislator, a state legislator, or a national legislator. Those of us who are in public policy are always looking for additional eager people willing to help, because it's a big country. I'm in a big state, and there's too few of us doing this. And if you simply show up where other people who are doing public policy are gathering, you will likely get tapped very quickly and put into a position of responsibility and help accelerate your interests.
Yeah, I think establishing yourself is key. I think too few who are new to this public policy arena don't give themselves enough credit. I think that you're an immensely powerful resource for them, and your perspectives, as we've mentioned before, personally are really things that they remember. And many of these people, you'll start to understand the spheres of influence on a consistent basis, that things that you say will stick and are really vital. Because if you think about all the policy work that you talk to in the legislator and the staff hear thousands of bills a year, and asks. And I think that the more unique we are, which we are, I think this is a really special relationship that people will understand and really want to participate.
Yeah, and I think I would also add attending the annual Urology Advocacy Summit every year. There are many younger physicians that have joined us at the summit. We get a chance to introduce them to some of our committee, council, and task force chairs. And who comes to mind is Dr. Juan Andino. I remember meeting him at one of the advocacy summits. I asked him what his interests were. He said telehealth. I remember him walking him over to Dr. Aaron Spitz and saying, I think you guys share something in common. The next thing we know, he's on the task force. And so I think of those types of activities where you come in, you meet other people that have an interest in policy, you network, you find a home and an issue that's near and dear to you, and fantastic opportunities at the summit.
And I'll add, as a fellow, Juan was able to be incredibly valuable to the task force. He brought us in connection with a state telemedicine alliance that we had no direct participation in, but that he found a way to become participated in. And then he became the liaison between these two organizations that have collaborated with sign-on letters and legislative advocacy efforts. And this was all through a fellow level participant in the AUA public policy arena. Incredibly valuable. So it doesn't matter what level you are at, you can have great value. I mean, just to be where you're at in your training, you're already an incredibly intelligent and capable person, and you can be leveraging that at this time in the sphere of public policy.
Yeah, that's really impressive. I didn't know that the other one was doing that. But the thing I was going to mention was, we've talked a little bit about telehealth, and it's obviously one of the top legislative priorities now for the AUA. If you're able to expand upon that, and then if there are any additional major efforts right now going on.
So telehealth has really become a front and center issue because of the unusual circumstance of the pandemic. And the American Urological Association is very proud that we had our finger on the pulse of telehealth well before the pandemic, recognizing the potential value it could have for urologists. And once it hit, we were able to mobilize rapidly and educate our membership through a variety of resources that enabled urologists to become the most utilizing of all specialties with regards to telehealth. Now, this is an ongoing process. There were waivers that were established by CMS during the early days of the pandemic, which liberalized our ability to practice telehealth. Waivers meaning that the way the law is written, we can't really practice telehealth outside of a very narrow spectrum of circumstances. A rural location, the patients had to go to a designated type of facility to then have the telemedicine interaction. And now, as you may well know, patients can do it from their homes, whether it's rural or whether it's urban. But these waivers, which are allowing us to practice telehealth and meet our patients' needs, will expire when the public health emergency is declared to be over. And then we will have to revert back to that very limited scope of telehealth. So the American Urological Association's telehealth task force, as well as a variety of the committees and resources, have all been brought to bear to try to make sure that these allowances from the waivers are continued beyond the public health emergency declaration period. And so there are a couple of bills that are working their way through the Senate and one that'll be introduced in the House that are designed to do that to various degrees or in various capacities. The most prominent one is the CONNECT Act. And the CONNECT Act will allow the permanent continuance of patients being able to access telehealth from their homes rather than from a designated site of service. And it gives the director of CMS the power to continue these relaxations of restrictions that we have during this waiver beyond the public health emergency period. It's not a perfect bill, but it goes a long way. And there are other bills in the works that will address more directly the issues that are so critical to sustaining telemedicine, such as payment and payment parity, and even issues such as paying for telephone only as opposed to the audiovisual connection, which becomes very critical when we understand how spotty the infrastructure for audiovisual broadband really is throughout the nation, and also the challenges that many of our patients face just with the technology itself. So this is where we're at. We have a strong lobbying presence. We have the direct ear of CMS and the GAO and senators who are responsible for these bills, having had direct communications with high-level staff with all of these organizations. They know who we are. We're basically on each other's speed dial, if you will. And we've become an important resource in educating them about the pros and cons of telehealth, not just for urologists, but for all doctors across the nation. And we're going to continue to work hard, but we're very proud of what we've been able to achieve. And we invite more help from all levels. And it's really important that we get help on this from resident and fellow level advocates, because a lot of the issues that are critical with telemedicine do circle around training and telemedical supervision now and indefinitely, depending on what we're able to accomplish.
I'll add there are, thanks, Dr. Spitz. I'll also add that the other bills that we worked on in terms of AUA sponsorship include the rural workforce, where we urge the House to co-sponsor the HR 944, which is a bill that encourages urologists and other specialty medicine physicians to practice in rural communities by offering a loan forgiveness program in conjunction for these important providers. Another aspect of policy work is HR 4880. That was Congressman Dunn and Congresswoman Slotkin looking at veterans prostate cancer treatment and Research Act that was introduced in August, just in August. And that really just urges House members to become co-sponsors of the Veterans Prostate Cancer Treatment and Research Act, which really directs the Secretary of the VA to really move forward in a clinical pathway for prostate cancer and a registry. So these are other aspects too, just to give you highlights on a high level of what specifics we're doing. Kath, maybe you might comment on actually the CMS work. I know Aaron had mentioned this with telehealth, but how do we actually interact with them?
Yeah, thank you, Dr. Rees. So the AUA, as Dr. Spitz had mentioned, has had conversations with CMS, and we continue to do so, not just in rulemaking periods. When they propose something, we offer feedback. I think in this case, when we met with CMS this year and last year, we brought in several physicians to really talk about the implications of what CMS was doing in regards to telehealth. And the one issue that Dr. Spitz talked about that really resonated with CMS was the impact of removing anything that would actually put restrictions around audio-only visits. And so our physicians talked about everything from what if someone speaks English as a second language and needs to have an interpreter? What if someone has lower income and perhaps getting on a audio-visual call would use up all of their data, or perhaps they didn't have any access at all to the internet? So those are the types of issues that our physicians are bringing to CMS to say, I know this is what you're proposing, or thank you for what you've proposed, and let's discuss the implications of that in a real life scenario. So thank you, Dr. Reed.
Yeah, no, I actually just published a paper on telemedicine in the Gold Journal and cited the review that you wrote a couple of years ago. So I know I'm quite familiar with your telemedicine work and the impact that it may have specifically on these rural communities, as well as everyday practice. We've talked about what we're working on now, but we also a little bit almost close to time, but if you had to pick one moment in your advocacy career that really made an actionable difference in the everyday practice of urologists and made a difference to you, what do you think it would be?
Well, I had been a delegate to the American Medical Association House of Delegates for many years. I started as in the young physician section and then worked my way up. And for many years, there was this issue called the Sustainable Growth Rate Formula, which was a law that required a certain budgetary mark be met for what all the physicians in the nation would get paid by Medicare. And this formula was flawed. And what was happening was that as each year would go by, we were getting overpaid according to this formula. And every year we would have to go to Congress and lobby to stave off that mandatory cut to our reimbursement because we already were being under reimbursed. And that we kept kicking the can down the line, down the road. But it took pretty much all of the oxygen in the room to fight against these cuts, leaving little space for other important advocacy efforts. It finally hit a crisis point where the cut was going to be about 21 or 22% across the board on all fees for all physicians. And it was going to go through, and it got to a fever pitch. And through our constant advocacy over those years and keeping it up, we were able to get legislation passed that eliminated that cut and rewrote the way the formula was written and how physicians were reimbursed. And it saved the physicians across all specialties and across America a devastating cut. A 21% cut is not sustainable. Practices would have closed down, institutions would have closed down, and it really would have been a disaster. Not only did it save the practice of medicine, it opened up the door to all other advocacy issues now that had been put on the back burner behind the specter of this one looming issue. And I was frustrated initially, and I was, dismayed at how this was this ever ongoing process. But at the end of the day, I was able to look back and see how those years of dedicated work with the AUA and across all specialties resulted in a key success that was instrumental in preserving the practice of medicine and allowed for a lot of other great stuff to follow. And I directly participated in that. And I take great pride in knowing that I directly participated in something that preserved the practice of my partners in my private practice, my colleagues in academia where I used to work, and ongoing into the future. So that was a big win, but it was a long process. And it taught me that a lot of times these successes are long processes and you have to just hang in there.
All right. I completely agree. I remember as a medical student when I first met you, as at the AMA House of Delegates meeting a long time ago. I remember the sustainable growth rate was the focus point, and actually for me to kind of finally see that get repealed was actually shows the power of persistence. I think we are at about time. I would like to thank all of our speakers for joining us today on their Sunday morning. I really do appreciate it. I'd like to thank the audience for joining us as well. Thanks so much.
Thank you.
Thank you, Juan. Thank you, Kathy. Thank you, Eugene. And I really hope that we've inspired you to understand how valuable and important you are and how straightforward it is. Just show up, go to the right places, and you will find yourself in very exciting and important positions before you know it.
Yeah, and I'll close real quick. I think that the relationships you build also on a personal level, practice can be quite lonely, right? When you get out in practice, the only people you see are the patients that you deliver, that nursing staff, and your fellow urologists in your practice. But this is a way to think of yourself as we started this is the why you do what you do. I think you get a lot of gratitude, which translates to a sense of wellness and well-being. If you can really translate the why as you grow in your practice. Thank you all.